Hello and welcome back. In this lecture, we're going to be discussing sleep, wake, and paraphilic disorders. So the first section of disorders we're going to discuss today is sleep wake disorders. These are disorders that are characterized by disturbances in sleep amount, quality, or timing. They're often comorbid with other medical or mental health conditions, meaning they are often paired with other conditions or whatnot that kind of play off of each other or can play a role in the etiology of the disorder. So the major categories in this section are insomnia disorder, hypersomnolence disorder, narcolepsy, breathing-related sleep disorder, circadian rhythm sleep-wake disorder, parasomnias, and substance and medication-induced sleep disorders. So first, let's talk about insomnia disorder. The key feature is difficulty initiating or maintaining sleep, early morning awakening. The criteria, it occurs 3 nights a week for 3 months. So remember that duration is important to make sure we maintain the duration. Cause significant distress or impairment and is not due to another sleep-wake disorder, or substance, or coexisting condition. Hypersomnolence disorder. This is excessive sleepiness despite adequate sleep. So this is that person that's actually getting adequate sleep but often sleepy or often fatigued. The criteria are sleep lapses during the day, non-restorative long sleep, and difficulty being fully awake. Occurs 3 times a week for 3 months. Again, got to capture that duration. Not explained by another sleep disorder or condition. Next is narcolepsy. This is irresistible need to sleep, lasting into sleep, right? The criteria is cataplexy, Hippocratic deficiency, REM sleep latency of 15 minutes, of greater than 15 minutes, I'm sorry, and occurs 3 times a week for 3 months. Next, we have breathing related sleep disorder. There's different types of this sleep disorder. We have obstructive sleep apnea. We have central sleep apnea or sleep related hypoventilation. And the criteria is evidence of abnormal breathing during sleep, daytime sleepiness, fatigue, or insomnia symptoms, and confirmed by via a sleep study. So there needs to be a sleep study confirmed to actually collaborate the symptoms of this disorder. Circadian rhythm sleep wake disorder. This is a misalignment between internal clock and desired sleep times. So the types are delayed sleep phase, advanced sleep phase, irregular sleep wake, non 24-hour sleep wake, and shift work type. And the criteria is persistent sleep disruption and causes significant distress or impairment in important areas of functioning. Parasomnias. This is abnormal behaviors during sleep. The types are non-rapid eye movement, sleep arousal disorders, nightmare disorders, or REM sleep behavior disorders. And the criteria are episodes of recurrent and cause distress or functional impairment. Substance medication induced sleep disorders. These sleep disorders are due to substance use. Um, Disturbance occurs during or soon after substance use, cause significant distress or impairment, and not better explained by another sleep disorder. So now we're going to move on to paraphilic disorders. Paraphilic disorders are disorders where it involves intense or persistent sexual interest other than those related to genital stimulation or preparatory fondling with consenting mutual partners. So the core components for the diagnosis, they must last at least 6 months, cause distress or impairment to the individual or to self, involve harm or risk of others, and the DSM-5 disorders we have are voyeuristic, exhibitionist, photoristic, sexual masochisms, sexual sadism, pedophilic, fetishistic, and transvestic disorders. So let's talk about the first, voyeuristic disorders. This is observing unsuspecting individuals who are naked, undressing, or engaging in sexual activity. These are people who would sneak to look at someone or have an interest in peeping with someone when they're undressing or getting dressed or engaged into sexual activity. Right. The criteria is it must last at least 6 months. Acting on urges or marked distress impairment. If they didn't act on an urge, an individual is at least 18 years old. Next, we have exhibitionist disorder. This is an individual that is exposing genitals to an unsuspecting person. The criteria is it must last at least 6 months, acting on urges, or has causes distress or impairment. It may target prepubescent children, adults, or both. Photoristic disorders. This is touching or rubbing against a non-consenting person. This is a person that may be at a store that wants to rub against someone and touch them or whatnot, or they're touching someone that's non-consenting. The criteria lasts at least 6 months. Act there and they've acted on urges or it causes distress or impairment. Sexual masochism disorder. This is sexual arousal from being humiliated, beaten, bound, or otherwise made to suffer. The criteria is to last at least 6 months. Acting on urges or causes distress impairment. Includes specifiers with asphyxia. This is arousal via restriction of breathing. Sexual sadism disorder. This is a sexual arousal from being from the physical world or psychological suffering of another person. The criteria is it lasts at least 6 months, or acted on a non-consenting person, or causes distress impairment. Paraphilic disorder. This is sexual arousal involving sexual activity with a prepubescent child, generally age 13 or younger, at least 6 months. The criteria lasts at least 6 months. Individual is 16 or older, and at least 5 years older than the child. Acting on urges or causes distress or interpersonal difficulty. The specifier is exclusive or non-exclusive. Attraction to males, females, or both, and limit to incest. Fetishistic disorder. This is a sexual arousal from using a non-living object or highly specific non-genital body part. The criteria is it lasts at least 6 months, causes significant distress or impairment. It is not limited to clothing, used in cross-dressing or sex toys. And finally, transvestic disorder. This is sexual arousal from cross-dressing. It must last at least 6 months, causes distress impairment. Specifiers with fetishism, with autogenophilia, from thoughts and images of self as a female.